Hello everyone. Today we will talk about what is asthma. We are going to learn what are the risk factors, what are the signs and symptoms, how do we prevent it, and how is the disease diagnosed. First of all, we are going to look at asthma. Asthma, we need to remember this because this is key in understanding as nurses why our patient presents with the symptoms that they have. We have to remember that it's chronic. When we say it's chronic, means it's long-term. It's not acute. It's not something that is a one-time episode, but this is something that a patient diagnosed with asthma has to deal with throughout their lives. So it is chronic, it is long-term, and therefore most chronic conditions do not have any cure. And that is important to remember when we talk about treating asthma. It is an inflammatory disease of the airway. So a very important concept to remember about asthma and the understanding. It is chronic. It is inflammatory. It is a disorder of the airways. About 25 million people in the United States have the disease. That includes both children and adults. This condition is responsible to about 14 million physician office visits and about 1.75 million outpatient emergency visits. This disease kills about 3,500 Americans each year. However, given that it's a chronic condition, with proper treatment, most patients can and lead full lives with no limitations. Going back, asthma is a chronic inflammatory disease of the airways. So one concept here, you will see what is an airway. An airway is that main tube that goes into the lungs and allows air that we breathe in to pass in and out of these tubes, and this is what we call the airway. This is what's affected by asthma. In asthma, this airway that is open becomes constricted. Therefore, it is hard for air to pass in and out of this person who is having an acute asthma attack. This is why when we say disorder of the airways, this is what it affects the airway and affects oxygenation and the passage of airway into the lungs of this patient. What are the signs and symptoms of asthma? Well, the signs and symptoms of asthma, that person will have difficulty of breathing. Now, this is SOB, stands for shortness of breath, because of that constricted airway. And therefore, it will follow that that person will have wheezing, that musical passage of air into that narrowed airway. Usually people who have asthma will have some form of expiratory wheezing. Those sounds, because that's the sound of the air passing through a very constricted airway. Wheezing is also the tightness of the chest because it is hard for them to breathe, so they may have symptoms of tightness of the chest. Also, coughing. Coughing, non-productive coughing, can be symptoms of asthma. Now, in people who have had or is having an acute asthma attack, as a signs and symptoms, it depends on how long they've been having the attack. It may also cause some cardiac compensation where there is an increase of the heart rate. We already know that when it follows with a shortness of breath and wheezing, that person has difficulty of breathing. That person will also have a high respiratory rate or a high breathing rate. These are the signs and symptoms of asthma. You have to remember that 50% of asthma are of children with asthma and some adult. This airway inflammation that results into the bronchoconstriction or the narrowing of the airway is caused by allergens. So it is important for that person to find out what is their trigger. What is the allergen that is a trigger for their asthma attack? The goal in the prevention of asthma is reducing the risk as well as making sure that person with asthma is able to function productively in society, and that is basically preventing risk. Let us move on to diagnosis. How is asthma diagnosed? Asthma is mainly diagnosed predominantly by history. History plays a role in finding out and in the diagnosis of asthma. History of recurrent episodes of wheezing, coughing especially at night, or what we call the nocturnal cough, and chest tightness or exercise intolerance. The provider will be asking the patient that, and if this occurs often, that usually also comes to mind. triggers allergen exposure. Pulmonary function tests. So this is what we call pulmonary function tests through the aid of a spirometry. Is also one way that asthma can be diagnosed. This is basically measuring lung function. This is what we call a spirometry. This person is asked to breathe out of this machine, and this machine measures the forced expiratory volume at 1 second and forced vital capacity of this person, and this usually results in a airflow obstruction. And the presence of airflow obstruction usually indicates, in combination with the history of the patient, will result in the diagnosis of asthma.